Good evening, everyone. So, my next video, which I'm going to discuss with you, is on the topic treatment of urinary tract infection. In the earlier video, I discussed with you about the urinary antiseptics. In this video, I will discuss with you about the urinary tract infection treatment. So, the mostly gram-negative organisms are responsible for the urinary tract infections. Acute episode can be treated by the single organism, and chronic and recurrent episode can be caused due to mixed infection with more than one organism responsible for the chronic or recurrent infection. Acute infection is largely self-limiting. Self-limiting means it occurs by itself after some time. There will be high urine flow rate. There will be frequent bladder voiding. Lower urinary tract infection is the drug given a single dose antibiotic or 3 days course will suffice the acute infection. And upper UTI infection requires the longer treatment. So, bacterial investigation is very important for the treatment of the urinary tract infection. Smaller than usual doses required for treatment of the urinary lower UTI. Then upper UTI requires normal doses as for any other infection. Means less doses are required, lower doses are required for the treatment of the lower UTI infection, and for the upper UTI infection, we have to give the normal doses. Least toxic and cheaper drugs should be chosen for proper duration. We have to give the least toxic and cheaper drugs for proper duration. Drugs should not disrupt the normal gut and perineal flora, and frequent recurrences, chronic suppressive treatment with cotrimoxazole, nitrofurantoin, methenamine, cephalexin, and norfloxacin. In case of the frequent recurrences, means the recurrent UTI infection, we have to give the chronic suppressive treatment with cotrimoxazole, which is the sulfamethoxazole and trimethoprim combination, nitrofurantoin, which is urinary antiseptic, methenamine, cephalexin, which is cephalosporin, norfloxacin, which is the fluoroquinolone. So the drug therapies, bacteriostatic drugs are the sulfonamides, tetracyclines, and nitrofurantoin. Bactericidal agents are the cotrimoxazole, ampicillin, extended spectrum, penicillin, aminoglycosides, fluoroquinolones, and cephalosporins. Urinary antiseptics which can be given are the nalgesic acid, methenamine, and nitrofurantoin. So first of all, sulfonamides. These are effective against the E. coli, that is Escherichia coli. Ineffective in chronic, complicated cases or mixed infections. Cheap, easily available, and effective orally. Bacterial resistance, major problem. Bacterial resistance is the major problem with sulfonamides. Drug of choice is sulfasalazole 2 gram initially, 1 gram. QID means 4 times a day for 7 to 10 days. Prerequisite alkaline urine and liberal fluid intake. Cotrimoxazole, highly potent and cost-effective bactericidal combination used against Escherichia coli and Proteus. Acute UTI, the drug is two tablets twice daily for 7 to 10 days. Chronic UTI, 1 tablet twice a week. Contraindicated in the pregnancy, successful in the recurrent UTI in men with prostatic focus. Means those who are suffering from prostatitis, we can give this drug, cotrimoxazole. Ineffective in the renal insufficiency. Ampicillin is effective bactericidal to Escherichia coli aerobacter, Proteus pseudomonas resistant. It is the drug which is Proteus and pseudomonas resistant, that is gram-negative bacilli resistant, and it is effective against the E. coli and aerobacter. Ineffective against the penicillinase producing staph aureus and safe in the pregnancy. Dose is 0.5 gram. QID means 4 times a day for 7 to 10 days. Resistant strains of E. coli, especially hospital acquired, has been found. Means resistant strains of E. coli, especially hospital acquired infections, has been found. Extended spectrum penicillins are the carbapenicillin and piperacillin. These are used in the pseudomonal infections of urinary tract infections. And these are combined with gentamicin. Carbapenicillin is combined with gentamicin to treat infection against Pseudomonas. Piperacillin is a broad spectrum activity against the gram-negative organism, especially Pseudomonas, and the dose is 4 to 8 gram daily in divided doses. Status is used only to be should be limited to severe life-threatening conditions. Aminoglycosides, these are gentamicin is the aminoglycoside which is used in the treatment of urinary tract infection. It is effective against E. coli, Proteus, and Pseudomonas. Disadvantages, it is given parenterally, so it can cause renal toxicity, ototoxicity, and neuromuscular blockade. And reserved for complicated UTI. This is the drug gentamicin, which is reserved for complicated UTI. Fluoroquinolones, these are ideal agents and drug of choice, and these are given in the nosocomial, that is hospital-acquired pyelonephritis, complicated UTI. Present status is, it is first-line drug for all the UTI. Its present status is, it is the fluoroquinolone is the first-line drug for all the UTI. Cephalosporins is valuable in the infections resistant to other antibiotics like E. coli, Proteus, Pseudomonas. Means it is valuable in infections which are resistant to other antibiotics like E. coli, Proteus, Pseudomonas, and drug of choice for the Klebsiella infections indicated in the septicemic UTI. This is indicated in the septicemic UTI, cephalosporins. So, we just remember the drugs which are given for the treatment of the UTI. This is remembered by the Q bats. Q for quinolones like norfloxacin, nalidixic acid, beta-lactams like ampicillin, amoxicillin, aminoglycosides like gentamicin, amikacin, cephalosporins like third generation cephalosporins, tetracyclines, and sulfonamides like cotrimoxazole. Other antimicrobials can be chloramphenicol, methicillin, carbapenicillin. So what are the general principles of treatment? Acute cases, treatment is the immediate. Chronic cases, we do the treatment after investigations. Drug must achieve adequate concentration in the tissue and lumen. And drug must be cidal or steric former, more capable. Cidal drug is more capable. Doses should be adequate for adequate period. pH of the urine should be maintained at level that permit optimum antibacterial activity. Urine culture, gram staining to confirm diagnosis, antimicrobial sensitivity testing to guide therapy. Predisposing factors must be eradicated. Means we have to eradicate the predisposing factors. So urinary pH and antimicrobial agents, acidic urine required for methenamine. Inadequate response in complicated cases, measurement and correction of urinary pH can be attempted. When there is inadequate response, like in complicated cases, we have to measure the urinary pH to see that whether the drug is effective or not. And urease are positive Proteus infections, drugs acting at higher pH should be administered. For the urease positive Proteus infections, we have to give the alkaline pH, the drugs which are effective at the alkaline pH. So, favorable urinary pH for antimicrobial activity are the acidic urine is required for the nitrofurantoin, methenamine, cloxacillin. Alkaline pH is required for the cotrimoxazole, the aminoglycosides, cephalosporins, and fluoroquinolones. And for the immaterial, pH is immaterial for the chloramphenicol and the ampicillin. So these are the various antimicrobial regimens for the acute UTI infection, which has to be given for orally for 3 to 5 days, like norfloxacin 400 milligram 12 hourly, ciprofloxacin 25 to 50 to 500 milligram 12 hourly, ofloxacin 200 to 400 milligram 12 hourly, cotrimoxazole 960 milligram 12 hourly, cephalexin 250 to 500 milligram 6 hourly, ceforex proxetil 200 milligram 12 hourly, amoxicillin clavulanic acid 500 to 125 milligram 8 hourly, nitrofurantoin 50 milligram 8 hourly or 100 milligram 12 hourly for 5 to 7 days. So urinary infection in patients with renal impairment, these are difficult to treat, and the drugs which are contraindicated in the renal impairment are the methenamine, tetracycline, cephalosporins, and drugs avoided are the nitrofurantoin, nalidixic acid, aminoglycosides, potassium salts, and acidifying agents are contraindicated. So prophylaxis of the UTI, this may be given when women of childbearing age group has the recurrent cystitis, catheterization or instrumentation inflicting trauma to the lining of the urinary tract is performed. Bacteremia frequently occurs and injured lining is especially susceptible. Means when there's catheterization or instrumentation, there can be injury in the inner lining of the urinary tract that can lead to urinary tract infection. So in those cases, we can give the prophylaxis for the UTI. And for the women for recurrent cystitis, we can give the prophylaxis for the UTI. Indwelling catheters are the placed. Indwelling catheters, when the indwelling catheters are placed, then also we can give the prophylaxis for UTI. Uncorrectable abnormalities of the urinary tract are present. Any abnormality, any obstruction, or any stricture formation is there. Inoperable prostate enlargement or chronic obstruction, including causes urinary status. Any chronic obstruction is there, or any prostate enlargement is there, which is inoperable. So in those cases, we have to do the prophylaxis for urinary tract infection. So that's all with the treatment of the UTI. I hope you understood this video. And if you understood this video and if it is helpful and useful to you, kindly subscribe to my YouTube channel. It's Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be blessed, stay safe, happy learning. All the very best. Thank you. Happy learning.